Hello everyone, I'm Professor Mark Baines with the Concordia University in Irvine, and once again this is Exercise Physiology for Sport. Today we're going to be talking mostly about the nervous system and skeletal muscle, and we're also going to be referring to fatigue and the immune system, as well as a little bit of the endocrine system, how so they interplay as well. Starting right away with some important concepts from previous weeks that everyone should know, whether they're taking the course or not. The lactate threshold occurs between roughly 50 to 85% VO2 max, but the thing is this may vary day to day. It's going to change. An unfit person who's deconditioned, has not been training much at all, they're going to hit their lactate threshold around 50% of VO2 max. It's going to be really, really low. Remember, VO2 max is roughly the pace you could maintain for about 10 to 12 minutes if you're elite, or 10 to 20 minutes if you're the general everyday person, generally speaking. So the lactate threshold is anywhere between half that speed or effort or force output, we should say, anywhere up to about a little over almost, a little about 85% of it, so majority of it. So we're talking about the elite of the elite can maintain pretty close to their 10 to 12 minute pace of anything, effort-wise, work-wise, and keep it going for a really long time or awfully close to it. Whereas people who are not elite can't get anywhere near that. That said, when we're working on the lactate threshold, what we're really working on is specifically your ability to perform work such that you don't really require much rest because you can actually recover quite quickly from it. So to build that, we can't be working too intensely. A lot of people are referring to really intense exercise as lactate threshold level work. And when it gets intense, it's really not. If you think about it, your VO2 max, what you can do for 10 to 12 minutes, is going to be aerobic. So your aerobic work at best is 75% of your max force output. So let's say it's super elite person, close to maybe 75% of their maximal force capabilities is what they can maintain for 10 to 12 minutes. Well, if you do lactate threshold, it's something they can do for 15 minutes or longer. The best case scenario is your actual force output at lactate threshold is somewhere around 65-70% or less. So you're really talking about majority of people being 50-60% force output or even less than that when we talk about lactate threshold work. And that being said, that if you whatever your good day level is, whatever your normal day when you're peaking with your lactate threshold, if you have a bad day, you're worn out, you got a bad night's sleep, you didn't eat well, you didn't take care of yourself yesterday, you didn't have a good recovery workout yesterday, you didn't do all the things you're supposed to do to prep yourself, get ready for today's training session, and along with other factors we'll talk about in the coming weeks, your VO2 or your lactate threshold, well, let alone your VO2 max, are both going to be lower. So keep that in mind. We can't always say you're going to be the exact same level every single day or better. That is the goal. However, if they are not, it's either because we did something improper with training and planning with that, or they're not preparing themselves well enough outside of our training. We got to figure out what that is. We have to look at ourselves. We have to look at our athletes, see what they're doing as well. That said, regardless of who we're talking about, for whatever sports purpose or anything, you need to track force output. Don't just refer to work period or effort, which is fine. Both are good, but more importantly, make sure you're always referring to force output. I expect to see 100% force output. Well, if you do, we already talked about how important that it is to recognize that's 1 to 5 seconds work. You can't do 100% force output for 10, 15, 20, 30 or more seconds. You can't do it. Physiologically impossible. You can get close, and the more elite of an athlete we have, they can probably put out 90% force output for 30 seconds or maybe even beyond, but that's unusual. Not many people can. Okay, and certainly tracking heart rate. We haven't talked specifically about exact heart rates yet. However, there is a calculator you can find online where if you looked at heart rate to VO2 max calculator, you can actually compute, roughly speaking, it's not exact, roughly speaking what the heart rate would be given a certain level of VO2 max. Since we've talked about VO2 max or aerobic level of work being 100% VO2 max, again, what you can do for 10 to 12 minutes, less than that is going to be work that you could do for longer periods, right? That being said, if it hasn't already become clear, you make sure you need to understand that anytime we're referring to glycolytic work or anaerobic work of any kind, let alone the ATP, CP, creatine phosphate, adenosine triphosphate, primary focused work, which is anywhere between 1 second, essentially, and 2 to 3 minutes total between all those three of those energy systems, then we're basically talking about, excuse me, we're talking about well above VO2 max. So we really don't even talk about VO2 max anymore. You still want to take heart rate to see, roughly speaking, what someone should be. You want to make sure you're clear about if they're doing a quick little sprint or a set of push-ups, that whatever distance they cover in a given speed or how well they're pushing, how long they do push-ups for. Yeah, I don't know how many push-ups you did. I want to know how long you maintained quality push-ups the entire time. Far more important. Far more important. Okay, and that's what we record, and then record your heart rate too. What'd your heart rate get to? 115 while doing those push-ups, or 135 while doing those interval sprints or interval efforts. I like to call intervals sprints because sprints implies full rest and full speed. But interval efforts or work, record their heart rate so you know, roughly speaking, at that same level of output, what was their heart rate. So what should be seen over time is the output should be going up, force output wise, perception of effort might actually be dropping, and the heart rate should definitely be dropping. Now, please be careful about referring to perception of effort being lesser than force output. Some of you are saying sometimes when you're talking about work that sometimes it feels easy. Well, then it's not that high of intensity. It's just not. It's not their maximal force output. Usain Bolt's not going to run a 9.58, 9.6 and say it was easy. If he did, he's not telling the whole truth. That's the maximum speed he can run. Of course it's going to be high RPEs, as hard as you can possibly run. So certainly if someone's saying it's lower RPE than a 9 or a 10, and you're doing anaerobic speed work or conditioning work, then they're not giving you, either they don't have the capacity today because they're worn out, or what's the point of doing this short period work like we are, unless we're just trying to build skill and trying to build little bursts of skill like we do in some sports. We're just trying to run through plays. We're not trying to through sets of how we want something to occur in a game situation. That's different. But if your goal is to maximize the conditioning from glycolytic work or anaerobic type power for that 1 to 10 seconds or less, then we need to be making sure that they're getting forth the output. How do we know? We can't just watch. You got to have the stopwatch on. Got to be clear about exactly where someone should be at a given moment in time and space, and be clear and precise. And for the teams to be the championship teams, that's what they're going to need to be. For the athletes to get the most out of what they do, that's what they're going to need to do. And they won't know that. You know that. And that's what's going to have to happen from your perspective so they get the most out of their performance. And it's every set, every drill, every day. End of each set, what's your heart rate? What's your RPE? Scale 1 to 10, how does that feel? What's your heart rate right now? Record that data. And of course, you're recording force output as either speed, how fast they got through something, making notes of their technique and their skill throughout. Possibly it's loading, so it's possibly how long they're able to maintain a given load. Whatever it is, tracking force output in some capacity. Okay, force output, not just effort when they're performing any work. Adenosine triphosphate, creatine phosphate is dominant work when it's maximal power, and we said this before. I want to make sure you have this down now. You need 3 or 4 days between. You're not going to do well in 2 days between. You won't. You can't do 4+ sessions of anaerobic maximal power or near maximal power per week. You're not going to have the same level session every time. You're not going to get it, which means you're not going to be maximizing the whole purpose you're trying to maximize here, which is anaerobic power. So at least 3 or 4 days between. Unless we're talking about the elite of the elite, and to be honest, even the elite of the elite are not going to be able to do this on a regular basis. They're just not going to get their 95 to 100% force output consistently if they have only 2 days between or less. Okay, glycolytic work, the interval type work, conditioning type work, hypertrophy work, all that stuff is basically 2 to 3 days between. Some people can do it 2 days. Some people it's more likely 3. Less than that, highly unlikely. More than that, which a lot of people do with hypertrophy type training, they're going 5, 6, 7+ days for working a similar movement. They call it body part. We can't talk like that. Similar movement again, and consequently spending too much time away, which gets a form of detraining. And if you detrain a bit, you lose the benefit. We don't want to do that. Don't want to do it too often, but also don't want to do it too infrequently either. Aerobic work is every 1 to 2 days. I mean, because really what's between those other days, between the lighter than aerobic, is recovery days, active rest type days, doing something that's really not challenging really at all. It's just getting you moving through similar ranges of motion, similar ways you might move in your given sport or activity, or for whatever fitness level you're particularly pursuing, but moving every day. That's key for metabolism, that's key for recovery, that's key for readiness for the aerobic, glycolytic, or ATP-CP type anaerobic power work. High intensity exercise diverts blood flow. So when we talk about stress, we talk about the immune system, the endocrine system, nervous system, everything. Whenever you exercise intensely, blood flow goes to the areas that you're working. One of the reasons why high intensity exercise is so stressful is because it diverts attention away from everything else. So if someone's engaging in high intensity that's not ready for it, it's just not just that they can't perform as well, that their form breaks down, which is crucially important and not good, and that they also get fatigued and worn down because of all this effort being taken away from all the areas the body needs to be focusing on with getting proper blood flow and nutrients to it, and it can't because it's focusing on the exercise. And then at the exercise level, those muscles that are supposed to be doing the work properly, proper joint actions, proper endocrine system response, hormone response, proper immune system response, internally happening, nervous system-wise, firing the right muscle fibers at the right time in the right sequence, all that stuff is thrown off too, so the entire system is wreaking havoc, increasing more inflammation, increasing more stress, improper hormone responses, and that's what we're really trying to avoid. High-intensity exercise by itself does not guarantee anything. And many of you in your posts, although you may not think that it's the case, the way you're writing it does express the idea that you think that high-intensity exercise automatically creates better immune system response or automatically gets better progress. It's only if a person's ready for the activity itself, which comes part of, first of all, having the skill in the first place, then day-to-day being ready, okay? Let alone being ready throughout the course of the session itself, which means you have to properly design it. That said, I kind of already alluded to it, but if you're RPE, if you're engaging anaerobic power, if you're doing work, it's 1 to 10 seconds, it's supposed to be at 95 to 100% plus power, not 100% plus, but or close to 100% maximal force output, RPE's got to be a 10. If it's not a 10, it's not 95 to 100% force output. There's something there you could be doing that you're not. It doesn't happen magically without giving the effort. It doesn't. Okay? But of course, it shouldn't be straining. There's a difference there. Don't confuse someone straining and somebody giving maximal force output. When you have a poor facial expression and look strained, your technique breaks down. Technique breaks down, you're going to have problems from performance from a long-term perspective. Be careful of that. That's not something we want to see. A lot of people say you're not working hard unless your face is straining. If your face is straining, technique is breaking down. You sure it's what you want? Because that's what's happening. Okay? That said, if we're doing glycolytic work, high-end glycolytic type work, and RPE and anaerobic power type works, anywhere between 1 to 30 seconds type work at that 90+% maximal force output. And we're expecting to say a 9 or 10 RPE. If they're not saying that, then they're not at that output. They're just not. And how will we know? Well, test them. The beautiful thing about sprints or intervals or running is that you either get there or you don't. Or something vertical, you get there or you don't. And a drill and a sport, it's a whole different thing, right? Running a play, trying to figure out, was that really maximal force output? Well, clearly you can't have it. You can't have maximal force output in a sequence of plays and movements. It doesn't work like that. But individual variables you can do, from maximal speed, maximal power, near maximal threshold capabilities from glycolytic standpoint. Don't confuse it with lactate threshold. We say threshold meaning that between creatine phosphate glycolysis, that really high intensity type stuff at the maximization of incorporating glycolytic type work, where you have the ability to perform work for longer periods beyond just your anaerobic power type work. Okay. That said, alluded to this as well, full rest is only when everything you do hurts or general fatigue, meaning the whole body just you don't feel good. Your heart rate at rest is higher than normal. You're sitting there and your heart rate normally maybe 60, 65. Today it's 70, 75. When it's 10 to 15% higher than normal, 10 to 15%, that's a lot higher than normal. It may be a day either you do something super light, active rest, or maybe complete rest. That's something to discuss with the athlete and you, the coach and you, and the athlete, to be able to determine what's the most appropriate thing. Full rest or just active rest. Just lighten up a little bit, okay? Either way, we've got to figure out what makes sense today, because it's not always the same. Intricacies of hormonal balance. Response versus excess. Getting proper hormonal response is key. Avoiding excessive response, which is when you excessively get a given hormonal response from one hormone, it means some other hormone's being inhibited. Something else can't do its job, right? That being said, we have to understand that balance. Insulin is secreted from the pancreas whenever carbohydrate is present in the system, and of course the more simple that carbohydrate is, the more of a higher glycemic index it is, then the body's going to secrete more insulin to take care of it, to bring it, use it up quickly. You can't take in pure glucose or sugar or simple carbohydrates and the body converts them into glycogen. It does not work like that. You must take in glycogen, complex carbohydrates, polysaccharides in complex forms, whole beans, whole grains, basically wheat, potatoes. Some potatoes are better than others in terms of what benefits it can give some people. It varies with people, of course. But complex carbohydrate foods with low glycemic index, primarily to decrease the insulin response. Diabetes' problem is not too many carbohydrates. It's not. Never was, never will be. That is not the problem. It's the wrong carbohydrates. It's too much stress on the system, which we'll come to cortisol in a second here, which plays a role with why people have insulin sensitivity issues and diabetic problems. We're not talking about people who are born with diabetes, who are born and they're type 1 dependent, insulin dependent individuals. That's a different thing. That's a genetic thing. When you get type 2 diabetes, essentially all of a sudden, it wasn't always the case with you, but now you have issues with blood sugars, and insulin sensitivity is a problem. Your body regulating how to respond when you're taking carbohydrates is a problem. That's a lot deeper than you need to eat less carbohydrates. And that's also not going to solve anything. It really, really won't. It's going around the problem. That doesn't hurt. That hurts when you do that. Then don't do that. Okay, that's true. It'll stop hurting. The problem still is there. It has not changed one bit. And the moment you start doing anything again, it'll start coming back a little bit. Maybe not as quickly because you've rested it, so to speak, because you haven't done anything with it. That's the same thing you're doing when you actually take in less carbohydrate. In fact, because carbohydrate is the primary nutrient required for energy, primary nutrient required for fat and protein metabolism, primary for fiber. There's so many values for carbohydrate brain function. Lowering it is ridiculous, and it's the wrong advice for a diabetic to get from a doctor, generally speaking. It doesn't mean they shouldn't lower from what they are, but saying low carb for everyone makes absolutely zero sense. Okay, and that said, it also, insulin secretion when it comes to a higher level, when you're taking in more simple carbohydrates, or if in fact you are taking excessive carbohydrates, because that can be done, no question about it, okay, then you're going to inhibit glucagon. And glucagon is a hormone that metabolizes fat. Whereas insulin helps metabolize carbohydrate, glucagon deals with fat. So if one goes up, the other one goes down, and vice versa. Okay, that's important to understand that. But insulin is not the problem. It never has been, never will be the problem. People eating carbohydrates is not the problem now and never was. It's the fact the person is probably not exercising properly, if at all, and they have significant, up next now, cortisol secretions, high stress responses, which, by the way, inhibits carb metabolism and affects insulin sensitivity. So it's not so much that carb itself, it's a much deeper problem. And that's an important thing for us to understand. And when it starts getting deeper and deeper into this, of course, we're going to refer our people to specialists to help them. But I'd highly recommend an endocrinologist, not just a medical doctor, a general practitioner, to be giving more advice when they start suspecting major hormonal problems. Can't stress that one enough. No pun intended with the stress right there. But cortisol is the stress hormone, okay? Referred to as a stress hormone, or a stress hormone, really. Meaning, in times of stress, cortisol increases. It's part of the fight or flight syndrome response, the general adaptation syndrome, responding to stress. It's a very normal response. Cortisol is needed. It's going to catabolize tissues. It's also going to inhibit carb metabolism. It's actually going to start trying to mobilize free fatty acids and move proteins to tissues and whatnot. But some people take that as like a positive. Oh, it's good. We're secreting more cortisol. It means we're using more protein and fat. It doesn't work like that. The body's doing what it has to do in time of stress. Okay, does not mean it's necessarily a good thing. That said, it's also not necessarily a bad thing. It can be too much, though. Certainly as exercise wanes and you start taking your rest periods, cortisol secretions should go down dramatically. Okay, and certainly as soon as possible following the training session, cortisol should go down significantly. We've alluded to in the past that this idea that someone should have a higher heart rate during their day because of the exercise they engaged in, so they have a higher exercise post-oxygen consumption response is a positive thing. It is absolutely not true. The most elite people, who are the best conditioned athletes, are back to normal very quickly following training. That's exactly what you want to be, not feeling the effects for many hours after. That shouldn't happen at all. That being said, the primary area that reduces cortisol levels and actually reduces the catabolic stress and the potential long-term chronic issues that can come from training, we're talking about VO2 max levels being roughly 40-60% VO2 max. We're talking about your low to mid-level type work, whereby you're engaging no more than 60% VO2 max is probably about 70% or so, a little above it, max heart rate, not real high, and 40% is like a little over 50%, mid-50s, mid to high 50s. We're talking about low-level effort. That's where you're going to actually reduce cortisol levels below that of rest. Below that of rest. You actually have less stress on your body engaging in light activity, light end to maybe light to slightly moderate activity, than doing no activity. That's a huge, huge indicator of how important exercise is. It's better for you than nothing. Better for you than nothing meaning not better than nothing, better for you than doing nothing. that light to moderate level for pretty much everyone. However, that light to moderate level will differ for everyone. While everybody's heart rate may be roughly, you're trying to keep that same level relative to yourself, it does not mean we're at the same level of exertion work-wise, but certainly generally speaking, we're at the same rough level for ourselves, and that's going to maximize the strengthening of the immune system. That's going to maximize reduction in cortisol. It's going to reduce inflammation. It's going to get proper hormonal balance. It's going to help return to homeostasis. That's home base right there, folks. That's the kind of training level that should be following any highly stressful day, regardless whether that's due to exercise or due to something else. Testosterone is probably responsible for about 10% or more difference in hypertrophy, meaning someone with high testosterone could have 10% or more muscle size doing the same thing someone else does. This would be a dramatic difference. Having more testosterone help tremendously with force output, generally speaking, because of course it affects muscle mass. Generally speaking, why a lot of men tend to have a significantly better response when it comes to strength and power type sports and activities over women, at least the elite versus the elite. Not always true, right? But that said, generally speaking, is a difference in testosterone levels. And of course, in some cases, what you find, some women have high testosterone levels, in which case they can compete at the same level when it comes to some strength aspects and force output aspects that some men can. But like all things, there's so many other variations between limb length, basically mobility, right? Technique and skill. On top of it, there's so many factors that play a role in performance. But when it comes to hypertrophy by itself, if you don't have significant testosterone, you're not going to be able to maximize hypertrophy. It's just that simple. But moderate to high intensity activity is where hypertrophy is primarily benefited. It's also where testosterone is maximized. Not your high intensity of 90, 100% force output. It's about 70, 85%, somewhere in there. Okay? Adrenaline. Also a stress hormone, secreted during fight or flight stress responses, and it's specifically its job, of course, is to give you that burst of energy, not really energy, but feeling like you can do something and immediately have immediate response to respond, fight or flight, right? Respond right now, but it's very brief. Now, what happens with caffeine? People take a lot of caffeine in, you get secretion of higher levels of adrenaline. Now, what reason that's happening is caffeine actually blocks the adrenal receptors, making those adrenal receptors keep those floodgates open, so adrenaline just comes flying out, essentially. So you get that caffeine response, that buzz that you like, okay? However, when you dip into that well a lot, and you have to really be careful here, if you dip in that well too often, it responds with you getting fatigued and worn down. Key factor is if you're going to take caffeine at all, you better already be well hydrated, eating well, well rested. If you don't have that and you're knocking caffeine on top of that, it's going to take a really high amount to get any response from adrenaline, if at all, and it's also going to create more and more immune system issues and health issues, chronic related issues for you down the road with your health and well-being. That said, there are a lot of caffeine studies that are out there. We'll talk a little more about that in later chapters, but generally speaking, we're talking about when you're ready, again, well rested, probably well conditioned, right? Feeling good on the day, and you add caffeine to get you to super normal. You already feel normal, feel good. This makes you feel really good. You can't be taking caffeine in to make yourself feel good when you feel bad. That's a major problem, and there's a lot of problems coming down the pike for you if that's the case when someone's using caffeine that way. But 200 to 400 milligrams is considered to be a fairly safe area for someone who already has those levels readiness, right? You're hydrated, you're rested, you've been exercising regularly, you feel good. Now let's take that, give you a boost. About 30 to 60 minutes prior to activity can give you a significant boost. And of course, that being said, you still got to be careful, as you do with everything that you put in your body regardless, right? Concerns of amenorrhea and low bone mass in females. Well, when females, men in general can have hormonal problems as well, but they don't have the same challenge with, of course, trying to have children, right? So basically that menstrual cycle being thrown off plays large implications for women in particular if exercise is either too high of an intensity for too frequent durations of training, or for too frequent sessions, or the durations are excessively long at higher intensities. Length by itself, just like frequency by itself of training, is not going to specifically affect dysfunction or create dysfunction with the menstrual cycle or any hormonal dysfunction. It's when the frequency is often and the intensity is high, or the duration is long and the intensity is high. It's both, right? It's got to be two factors involved there, not just one or the other. That said, that can disrupt the menstrual cycle, and usually more younger females than older females. but that could be also probably because of the fact that they're still menstruating. At a certain point, menstrual cycle starts to deteriorate over time or to be lost over time as women age more and more and more. Just depends on the female, of course, right? That being said, somewhere in middle age, they refer to it, where it starts to become less of an issue because it's no issue after a while for some women. That said, it can get thrown off if we're not very careful with our activity, but to be fair, that kind of activity where we can potentially throw off someone's hormonal balance in general is not good. Guess where we got to start to get them back? Around perfect number, the big number that if you haven't watched this video, the other people are not going to know because they're not going to have heard this. It's the 40% VO2 max. It's that sub 60% max heart rate type work, just below that, somewhere at that 50, 55, 60% heart rate level, feeling pretty good, moderate, light level, moderate to low level intensity for that 20, 60 minute time frame. That's the getting you healthy level. That's where people need to be if they're having any sort of dysfunction, let alone hormonal challenges. And low bone mass, well, you start affecting the hormone response to a negative level. It's going to start affecting a lot of things, including bone density. Here's the kicker, though. It doesn't say it in the book. It often refers to calcium as being the primary problem. The primary problem is not the calcium itself, even though you clearly need to get that. The primary problem is getting the proper activity. We're talking about compressive force activity, which, yes, means impact, means you landing on the ground at the proper levels, of course, with the proper skill, but however, you got to do it. It's the only way you're going to build it. It's the only way, okay? And that said, 80% or greater glycogen depletion occurs within 90 minutes of 75% VO2 max work level. So we're talking about somewhere around 85% max heart rate, give or take, somewhere in there. Anything that's fairly intense. We're talking about you losing your glycogen levels pretty fast. And over the course of 90 minutes, 80% or greater, maybe than 90%. That's why we suggest anyone engaging in activity that's higher intensity, that is that 75% VO2 max or higher, let alone much higher than that, should be taking a carb drink in every 10, 15 minutes, or every 15, 20 minutes, if you're going to be engaging in that activity for an hour or longer. And if you ever got an exam question about glycogen depletion, when you need to be worried about the fact that it could be gone with high intensity, within 90 minutes. Refer to as 90 minutes, because that's 80% or greater right there. Yeah, you could lose all 100% of your glycogen stored in your muscles and your liver within 90 minutes. And that's assuming you even have enough to sustain exercise from eating properly. That said, inflammation happens. Can we decrease it? Yes, we can. How do we decrease it? Well, we just talked about that. Here's the intensity range we're looking at, the 40-60% VO2 max, and possibly closer to that 40%, even 30 to 40% when you have significant fatigue, significantly worn down, really light work. So light, it feels like it's maybe too light. That's probably what you're supposed to be doing today. You have general fatigue. You don't feel good. Nothing's doing it right. Some days, you get out there, you start training, working. I feel better. I'm feeling better. Okay. For those days you felt bad in the beginning and now you're feeling pretty good, don't go too high. Still should probably, if you want to be smart, still stay within that 40-60% VO2 max. I'd still keep it more of a moderate recovery type level. I think a good coach will allow that for the one day you're feeling bad. Multiple days either means you're physically sick or there's something wrong either way. And so we got to take a closer look at what's going on. Okay, but one day, yeah, lower the intensity. Regardless of the plan is for today, take care of your athletes. Okay, we're too hell-bent on, excuse my language, too focused on us making sure that we give them the maximal intensity without being sure we're giving them the right intensity, right? To strengthen the immune system, that 40% level up to the 60%, but probably starting closer to the 40%, going to dramatically reduce cortisol and strengthen the immune system response, strengthening and improving the natural killer cell response to any sort of invasion, so to speak, on the cells when a viral infection comes along. It can help keep you not from getting sick. You reducing intensity when the time comes can keep you from getting those colds and the flu, which can be a killer when it comes to your athletes during the season when they start getting sick. They should just want that to be happening. A lot of your athletes getting sick, it's something you're doing in programming. It's just that simple, okay? But stress day-to-day is going to change, so we have to alter our programs accordingly. So this next week comes in now, kind of continue what we're talking about here. You got to, in order to fire the right muscle fibers at the right time in the right sequence, which is the ideal result, which means getting proper movement. The difference between someone having their arms go back and forth while running and leaning forward, one person looks stiff, the other person looks fluid. The one that looks fluid and fast and strong, they're the ones that are getting the right fibers. There are 3 muscle fiber types. And firing in the right sequence, the right basically the right action potential coming from each motor unit to fire the right given number of fibers attached to that motor unit or that neuron to get them fired at the right time, the right sequence is not an easy thing to do. Okay. That said, We'll come back to that in a moment here. All or none law. Muscle fibers fire or they don't. There's no in between. You can't partially fire a fiber. You hear a lot about people talking about firing your inner pec, your outer pec, upper pec, lower pec. Can't be done. Doesn't work like that. Doesn't work like that. It's a fan-shaped muscle, and the fibers are on or they're off, but they are not partially activated or activating a corner over here or hit the bicep on this side but not this side. Doesn't work like that at all. All or none. Okay, a fiber is on, it's on. It's doing everything it possibly can. It's maximally giving its maximal force output capability. See, even though you systemically may not feel it when your certain fibers kick in and more fibers kick in, you won't feel like it's maximal until they're mostly all or pretty much all kicking in. Okay, even though each individual fiber technically is doing its maximal work. That's the all or none law. Okay, the size principle of fiber recruitment. Well, let's go to the next point right here. Your type 1 muscle fibers are the first muscle fibers recruited. They are red, they are slow twitch, they're meant to go for longer periods, they're generally highly defatigable. They're hard to fatigue, they can go for longer periods and do work at very low outputs. However, we're basically talking about muscle fibers that are going to give you no more than 60-70% plus, give or take, maximal force output, somewhere in there. When the exertion gets higher level, type 2A fibers are going to be kicking in. Hopefully you have more of those. A person who has genetically more than someone else, assuming with the proper training, theoretically should be able to perform at higher levels than the person who's not as genetically gifted. Those type 2A fibers are more fast twitch oriented. They're more pinkish. They're between the type 1 and the type 2X. They can perform work for shorter periods at higher force outputs than the type 1 fibers can. Okay, and type 2X goes even shorter. Type 2X, we're talking about maximal force output for very short periods of work, and they get fatigued really easily. If you haven't already figured this out, your type 2X fibers kind of work consistently with pretty much most of your ATP, CP type work, your adenosine triphosphate, creatine phosphate work of 1 to 10 seconds up to 30 seconds-ish, give or take. And the type 2A fibers are more glycolytic type focused fibers. They kick in somewhere in that 5-10 second range, but predominantly somewhere closer to 30 seconds where they kick in. And then type 1 fibers are the ones that are involved from the get-go. But here's the thing. They're involved only as the work goes longer and longer and longer. They're the only ones firing. Okay. Generally speaking, even though ATP is the first energy system used when it refers to exercise, it's the type 1 fibers that fire first. If you want to get maximal force output, you're trying to get your type 2X muscles to fire. You know, when you're not really fully warmed up, you try to run a little bit, and all type 1 muscles are trying to help. They can't get it done. Type 2A might be coming in a little bit, but maximizing your type 2X involved is going to take a little more work. You have to really build into it slowly before you get to that point where they can really fire like they should. Maybe take a few warm-up sprints, light drills, some other exercises you do, then all of a sudden, next thing you know, after 5, 10, 15, 20 minutes or whatever it is, now we're maximally getting our output, proper output here, type 2X firing like they should, getting the right fibers to fire at the right time, in the right sequence, hopefully getting proper movement, not just good force output, okay? Muscle actions. When you move something, that's the concentric action. When you hold it in place, that's isometric. And when you lower down, you slow something down, that's eccentric. If we're talking about football, you push someone, that's the concentric action. You hold them and try to keep them from getting in, try to keep them from rushing in and getting the QB, and we're talking about isometric. Eccentric, you're trying to slow someone down. They're coming at you, you try to back up, try to keep them from coming at you too fast. That's eccentric, slow them down. It takes less effort eccentrically, takes a little more effort isometrically, takes the maximal effort concentrically. It says it all over the place, and it's just not true. It says you're stronger eccentrically. No, you're not. It takes less force output to slow something down, eccentric, than it does to hold it in place, isometric, than it does to move it, which is change its direction, which is concentric. Okay? You'll fatigue first, concentric. Golgi tendon organs and muscle spindles. The GTOs are at the muscle tendon junction. Okay, their job is to regulate. Essentially, your Golgi tendon organ is going to regulate that tension. Okay, and their job is going to basically regulate tension and try to tell you it's too much tension and release if there's too much tension. Release if there's too much tension. Muscle spindles cause the muscle to contract if the muscle is lengthened too fast or lengthened too far. Okay, either one. The muscle spindle tries to contract to protect you. It's also called the myotatic reflex, and the GTO tries to get the muscle to release. Okay, what we're theoretically trying to do in a static stretch, you go into a point where you hold that very light contraction, Okay, that's the myotatic reflex you're engaging right now. That first point of contraction, you hold there. The muscle spindle is actually activating the muscle fibers a little bit there. You hold at that place, trying to get the GTOs to slowly override the muscle spindles so the muscle can now achieve a greater length and go back and do it again. Reciprocal inhibition. You bend your elbows so the biceps are performing work. As the biceps perform work, the triceps are released, so to speak. They're relaxed. They have to be. If they don't relax, you don't get proper movement toward elbow flexion. The triceps, the elbow extensors, have to relax. If they don't relax, you don't get proper movement. They're reciprocally inhibited. The opposing muscle, the antagonist, is reciprocally inhibited when you move. So 2 different ways of really getting stretching, moving better, loosening up a little bit, getting autogenic inhibition with a static type stretch, allowing for 20-30 seconds for the muscle spindle to be overridden by the Golgi tendon organs, okay? Muscle spindles overridden by the Golgi tendon organs. Or as you move, and more dynamically, as opposed to statically, moving back and forth, theoretically with good form and technique and not overdoing it by doing it too fast or out of control, which means you engage improperly the muscle spindles, right? Or trying to create too much tension, which you'd engage too soon at the wrong time, the Golgi tendon organs, right? Get the proper motions, proper movements at lighter intensities. By reciprocal inhibition, you should also increase flexibility as well. Kinesthesia, which is the awareness of your body in space, takes time to develop. Some of you may have what appears to be natural levels above others. And there's no question about it. But a 3.5-year-old has higher levels of kinesthesia than a lot of other kids her age. That's at least somewhat genetic. How much of it's also related to what we do with her on a regular basis? Well, that can be part of it too. That's why there's always that controversy. But all you can do is train something as best you can to see what you can do with it. That's all there is, right? Everything genetic is what it is. And we don't really know what someone's genetic potential really is. We can kind of see it when someone's otherworldly. You see someone that stands out going, oh, this person, if they actually even utilize half their genetic potential, is going to be better than everybody else. There are always those people. That being said, we have to develop proper coordination, proper movement skills, proper movement patterns. How do we do that? Well, we've got to be clear what the movement's supposed to be. Then you got to move as slow as possible. Slow as possible. Yep, slow as possible. With possibly reduced range of motion. Reduce the range of motion. Don't try and go as far with that arm action. Don't try and go as far with that press or that leg lift come up there into hip flexion, whatever the case it is, until they get better at it. They get more fluid, allow for greater range of motion. It should naturally come, of course. And low to no external loads. Don't load someone if they can't get the proper full range of motion under control, regardless of what we're talking about doing. If someone's going to go running and they can't do proper marching drills and make it look fluid and controlled, they probably shouldn't be running today, or lifting heavy for that matter, okay? And do it as often as possible. How often should I do it, coach? Every day. How often? Every day, as much as you can, right? You want to be a better golfer? Got to swing that club as much as possible. However, that club needs to be swung at the proper speed, right? Proper range of motion, move slow, possibly reduce range of motion, just like you would for any other skill you're trying to develop, okay? And of course, muscle cramping can be alleviated with both hydration and proper activity. Your book alludes to the idea that it's unproven that hydration levels have anything to do with muscle cramping. I think we all know, anecdotally, mind you, that water hydration levels absolutely can affect it. The problem is trying to measure it, trying to measure the timing when you have the cramp. All that can be difficult. The fact of the matter is, though, proper blood flow occurs with proper hydration. You better believe that plays a significant role in what may or may not be affecting muscle cramping, whether it be inhibiting muscular force production or just not allowing proper force production, and some of the muscles then overcompensating and then something cramping, or any other, a lot of possibilities may be playing a role. Certainly nutrient balance as a whole plays a role. But that said, proper activity should help with that as well. Moving the area that's cramping ideally is very helpful if it is all possible to do. In the intense cramping moments, that's harder, that's easier said than done. Someone giving light massage can often loosen up a little bit. Trying to get proper mobility out of it is key, and then moving that area as much as possible while getting nutrients and getting what's needed. For a significant, massive muscle cramping, if someone goes back into the game, you're not going to be at the same level. It doesn't work like that. You can't recover from a massive muscle cramp within a few minutes. It's going to take a lot longer than that. They're done for maximal capability today. Whether you want to put them back in the game or they want to go back in the game, that's a factor you and your athlete need to figure out. But they're going to be able to give you what they were doing before? Nope, they will not. Got to be clear, both of you, what that might mean and the potential risk of injury by forcing that issue. Okay. Training to reduce symptoms or precursors to disease. We talked about that realm, that area, that 30 to 40% for like really extreme situations of fatigue and being worn down, that sub 50, 60% max heart rate, and then getting as high as 60% VO2 max, which actually is closer to 70, 75% max heart rate when they're ready for still fairly light to moderate type activity, not terribly intense. Me at 48 years old, 75% max heart rate is in the mid to high 130s. Okay, it's really not all that high. And someone younger will be higher than that based upon their age, of course, right? But to really limit precursors to disease, we have to make sure we engage in regular activity at the right levels, and we got to make sure they're ready for the high intensity stuff. High intensity only works, is only beneficial if the person's ready for it. To say flat out high intensity exercise is a better choice makes absolutely zero sense. To say it's the best choice when someone's ready, oh yes, because you get more out of it if you can put more into it. But if you don't have it to put out there, then you're just not going to get the output you're looking for. You're going to increase stress, increase risk of injury and problems, and that's not worth it. It really isn't. I hope we take better care of our athletes than that. Final thoughts. We're now moving into we're in our fourth week now. Be really clear about being specific versus being general in your posts. You have to always be saying things like force output, heart rate, RPE, work duration, rest duration. Those things aren't there, you will lose points. Whether or not I mention it to you, you are losing points. If you're not making specific points and specific ranges that are consistent with what we know about muscle fiber types, what we know about energy systems, and what we know about how it relates to force output and levels of work, okay? And let alone any other factors you can incorporate in there. But avoid definitions, avoid giving too much general information. We can read that stuff. We got to show how to apply it now, okay? Exam preparation, that's week 4, whoever exam at the end of this week, watch the weekly videos, maybe again, maybe more than once, and going over the sample posts that I put in the course announcements every week to know what you were missing in your post. Look at the comments I gave you in your posts, because those are going to be key areas as well. And of course, reread or look over the chapters again for key ideas. It's going to be a 100-question multiple choice exam, 2 hours long. So you're going to have time to think about some things, but at the same time, you need to make sure you know enough. Otherwise, it will be difficult. It's multiple choice, A, B, C, D. No tricks intended for any given question. Okay. You have otherwise research paper up next week, the big one, the only paper you have. Okay. That said, you should already be figuring out right now, by the time you view this video, what's my topic going to be. Reading the course announcements, some guidelines I was trying to give you with this. Don't be too broad. Don't be using a topic that they've written books on. Training of young athletes, that is really broad. Training of young athletes for power, that's still too broad. Training of 8 to 10-year-olds for power in basketball. Oh, now we're getting somewhere. Okay, even though still that could be several chapters in a book, you got to think about it that way. It has to be something that really can't be written 100, 200, or 300 pages on easily. If it is, it's too broad of a topic. Okay, if you're not sure, email me and I'll help you try to refine it a little bit if needed in the same area that you want to create it in, but want to make sure that we get an effective paper there for you that gives you meaning and obviously accomplishes the purpose of being a paper that is required for a master's degree program. Okay, 1,000 to 1,500 of your own words. Anything that's quoted is not your own words, doesn't count. Your citations don't count. Any of that stuff. So it has to be your own words. Make sure you read the expectations of how you write that paper, making sure you have an abstract in the beginning, make sure you have a conclusion at the end, make sure you have all the guidelines met from APA format standpoint, and don't make some of the major errors that are made. And I made note of those in the course announcements about that as well. You want to get an A, it's got to be well written, virtually free of any grammatical or content errors. You might have 1 or 2 that sneak in there. You start getting a few, there's no way you can get an A on the paper. An A paper means you've reviewed it many, many times, and oftentimes you'll find that what you thought was a good paper, the more you review it, it's not as good as you thought, but you got a chance to refine it, and that's what everyone does to create quality work. Go over their work again and again and again. That's how we create great work. Doing well so far. Keep up the great effort. Let me know if you have questions or concerns, as always.